Mr. President, I thank my colleagues that led this effort on this non-discrimination bill, which was historic, and pleased that we had a bipartisan vote to make America a more accepting and just place, and it's a work in progress, and really pleased that we could find the support on this floor to do that. Now the bill goes to the House, and I urge my colleagues and my congressional delegation and others to look at this bill with an open mind and an open heart and end discrimination in the workplace, and I hope that they will. Mr. President, I'd like to speak about a bill I plan to introduce in just a few moments, and hopefully we'll have some chance or opportunity in the near future to debate it because it's a very important fix, if you will, to the Affordable Care Act. When we debated this bill for literally years and months in committee for hours and hours and hours in the daylight, during the evening sessions, there were hundreds and hundreds of amendments built. This bill was built with Democratic and Republican support and input, not support. The Republicans did not vote for the bill, but they most certainly had a tremendous amount of impact and in the amendment process. Anyway, building a new health care system for this nation has been very difficult, but it holds a great deal of promise. The Affordable Care Act, in its largest or easiest way to explain it, was somewhere between where some people on the left wanted a government-run system, something like Medicare for all. It's appealing, but it's very expensive. We couldn't figure out a cost-effective way to provide that. Members on the right, more conservative-leaning in this body, wanted to just provide savings accounts, which works beautifully for people who have money to save in the account, but for people who live paycheck to paycheck and there's no money to save, they never get any account to be able to provide for their health insurance. So between those two bookends, we debated for a long time about how to provide a market-based approach for insurance. No nation in the world has attempted this, so this is a big effort, but it's an important effort because we are a developed nation. We need to have a healthy workforce. It's about as simple as that. You can't be number one in the world, you can't be the strongest economic power in the world if your people are sick and weak. It's just about as simple as that. And you can't be the strongest economic power in the world if your health care system is sapping so much money out of your economic power. 19% of the GDP, when Japan is 8%, you can't expect to beat Japan in economics if we're paying almost twice as much for health care and getting less results. So we had to change. So we did, and we built a market-based approach, contrary to what all the opponents of the Affordable Care Act say. We built a market-based approach that basically said, if you're over 65, you're on Medicare, and we're continuing to reform and strengthen Medicare. There are some very good parts of it, and then there's some weaker parts or difficult parts that need to be corrected. And over time, we will continue to streamline, save money, provide better service, more choice, et cetera, et cetera. If you are among the poorest members of our country, 133% of poverty, which is about an income of $15,000 or less, potentially you're just not able to find a good-paying full-time job. Perhaps you didn't receive the education that others have received. Perhaps you've got some disability. You would go under this plan on Medicaid, and then everyone in between the lowest income and the age of 65 is in a private health care system, which is a market-based system, competition, driving prices down. The idea would be that there would be 20, 30, 40 health care plans in every state offered. People can choose what they want with a minimum bronze, silver, gold plan with lots of choice. That is the promise, that is the hope, that is the idea. And the great promise of this is that if you have cancer, you can't be dropped. If you have diabetes, you can't be turned away. So when everyone is covered, the risk is spread, the price comes down, and the free market operates. Now, you'd never know that based on the criticism that you hear on television and radio all day long, but that's the truth. One of the important components of that bill that many of us talked about was the fact that if you had individual insurance on the market, you could keep that. What's happening now, unfortunately, because that grandfather provision in the Affordable Care Act, in my view, this may not be shared by everyone on the floor, but in my view, was not written as tightly as it should have been, as clearly as it should have been. So my bill that I'm introducing today, keeping the Affordable Care Act, Promise Act, keeping the Promise Act, which I'm introducing, will clarify this grandfather clause in the Affordable Care Act, so that it will clearly say, if you had an insurance plan that you liked, that you could afford, that you felt like you felt like that's what you wanted and you could afford, you can keep it. This bill, if it passes, will allow anywhere from 5 to 7 million people who are getting notices like this in the mail every day, and I'm going to read this into the record. This is a letter sent to someone in my state. It says, "Thank you for your support of Vantage healthcare plans over recent years. It's been our pleasure to serve you. We hope you've been satisfied. In light of the recent changes in the healthcare insurance industry, Vantage will be discontinuing our offering of grandfathered individual plans effective January 4th. This discontinuance will affect your policy. Vantage is pleased to announce the availability of several new individual products in 2014. They go on to say, beginning in 2014, you'll have the option to enroll in a new plan through the Health Insurance Exchange. Members enrolling through the marketplace may be eligible for premium or cost share subsidies because everyone in Louisiana with a family income of up to $90,000 a year is going to have some sort of premium support, which is going to be a great help to many of our middle-class families. Many of the marketplace plans will provide you with more generous coverage than your current grandfathered individual plan. We invite you to visit us online to review our exchange. You may also go to www.healthcare.gov. In addition to the exchange plan offerings, you will have several new plan offerings available outside of the exchange. These plans are similar to your Freedom or high deductible plan. We will have information. So this is a letter that thousands of people are getting, and this letter never should have gone out, because we said to people, if you had insurance that you liked, you could keep it. We didn't say if you had insurance that you liked that didn't meet the minimum standards or met the minimum standards, you could keep it. We just said, and the president said over and over, if you have insurance and you like the insurance you have, you can keep it. That is what my bill, that's the single focus of my bill. This is not to undermine the Affordable Care Act. It is to strengthen it and to keep our promise to the millions of Americans that we said if you have insurance, you can keep what you have. If you don't, there's going to be this new marketplace where you and your family can go and choose among a variety of different plans, and depending on your income, have support from the community or from the government. And then if you're extremely poor, we can provide options for you through Medicaid. Not as desirable as private insurance, but many governors, including some Republican governors, are being very creative with their Medicaid plans and actually changing them into more of a sort of a private-like insurance model. So there's great flexibility in how governors that have good hearts and good intentions are using their Medicaid dollars wisely. But having said that, having reread the grandfather clause, looking at it, very closely, I've determined that this is the best course to introduce this bill, which I will do later this evening to actually file it. And again, it has two simple directives. One, all insurance companies shall continue to offer grandfather plans that were in effect prior to a certain date. And number two, every insurance company that provided those grandfather plans has to explain to those policyholders how their current plan falls short of the new standard on the market and what might be available to them that's better, but they're not forced to buy it. So I hope that we can debate this with the idea, unlike many on the other side, want to tear the act down and repeal it, defund it. They've even taken the whole federal government hostage and the whole economy of the United States hostage. That is what they tried to do. They failed, thank goodness, and the hostages have been released. The government is back up and operating, but there are some of us who are sincere about supporting the concepts of this bill, the promise of this bill, which is extraordinary, really, and historic, but we recognize that there are some pieces of it that need to be fixed or tightened or tweaked to make sure that it's going to work in the future as we have said. So again, that is simply what my bill does. I'm happy to introduce it. I've got one co-sponsor, Senator Manchin from West Virginia, but many others have expressed their interest in working with me on this, and I look forward to bringing this before the committee for full debate and hopefully to the Senate floor in some way in the near future for debate and hopefully for passage. And I yield the floor.